Hey everyone, it's Emmy, and welcome back to my channel. Today we're going to be talking about something that's super important, especially for all my nurses out there, hand hygiene. As healthcare professionals, you know that hand hygiene is one of the most critical things we can do to keep our patients safe. It's the first line of defense against infections, and it's something we should never take for granted. You know that feeling when you're about to eat, and you realize you haven't washed your hands? It's kind of gross, right? Now imagine that feeling but magnified 100 times because you're about to treat a patient who's relying on you for their health. Not a good feeling, right? We're going to dive deep into why hand hygiene is so crucial, breaking it down into 7 key points. From preventing the spread of nasty infections to protecting ourselves and our patients, we'll cover it all. So if you're ready to learn how to be a hand hygiene hero, stick around. Hand hygiene is one of the most critical practices in nursing care to ensure patient safety and prevent healthcare-associated infections. We all know that hospitals and clinics are places where people go to get better, but they can also be breeding grounds for germs. Think about it. Patients come in with all sorts of illnesses, and those germs can linger on surfaces, in the air, and even on our clothes. Now imagine a tiny, invisible enemy like a virus or bacteria just waiting for the perfect opportunity to strike. That's where hand hygiene swoops in like a superhero. By washing our hands thoroughly and frequently, we're essentially disarming those germs, stopping them dead in their tracks before they can cause any trouble. That's especially important because many patients in healthcare settings already have weakened immune systems, making them more vulnerable to infections. Proper hand hygiene helps create a safer environment for everyone. Have you ever seen those diagrams that show how easily germs can spread from person to person? It's like a chain reaction, and all it takes is one weak link to keep the cycle going. But here's the good news. Hand hygiene is like that super strong link that breaks the chain. Think of it this way. You touch a surface that has germs on it, maybe a doorknob or a patient's chart. Now those germs are on your hands just waiting for their next ride. If you touch your face, you could infect yourself. If you touch a patient, you could pass those germs along to them. But when you wash your hands, you're essentially cutting off the germs' transportation system. They can't hitch a ride if there's no ride to catch. Okay, let's talk about some of the heavy hitters in
This video was proudly sponsored by Gologen, GoLogin, the best browser for multi-accounting. That was a brief moment, ladies and gentlemen. Let's get back to our video.
the world of infections, things like MRSA, C. diff. These are some tough bugs that can cause serious problems, especially for patients who are already vulnerable. Imagine you're a patient lying in a hospital bed, maybe recovering from surgery or fighting off an illness. The last thing you need is to be exposed to another infection that could make you sicker. That's why hand hygiene is so essential. It's like putting on a suit of armor for our patients, protecting them from those unseen threats. It's about giving them the best possible chance at a safe and speedy recovery. Chapter 4. Let's not forget, as healthcare professionals, we're on the front lines of healthcare every single day. We're exposed to a lot of germs, and even though we wear gloves and other protective gear, we're not invincible. Remember, our health is just as important as the health of our patients. If we get sick, we can't be there to provide the care that our patients need and deserve. So, hand hygiene isn't just about protecting them, it's about protecting ourselves too. It's like that old saying, you can't pour from an empty cup. We need to take care of ourselves so we can continue to take care of others. Chapter 5. Cost-effective intervention. Now, let's talk about the financial side of things because, believe it or not, hand hygiene can actually save hospitals and healthcare systems a lot of money. Think about it. When patients get infections, they often require longer hospital stays, more medications, and additional treatments. All of that adds up. We're talking about big bucks. But here's the thing. Hand hygiene is incredibly cost-effective. Soap and water, hand sanitizer, these are relatively inexpensive tools that can have a huge impact on preventing those costly infections. So, Not only is hand hygiene good for our patients and for us, but it's also good for the bottom line. It's a win-win-win situation. Chapter 6. Ethical and Professional Responsibility. As nurses, we take a pledge to care for our patients, to do no harm, and to always act in their best interests. That's the foundation of our profession. It's what we stand for. And you know what? Hand hygiene is a fundamental part of that pledge. It's one of the simplest yet most effective ways to fulfill our ethical and professional obligations to our patients. It's about upholding the highest standards of care, about showing our patients that we respect them and their well-being. It's about doing the right thing, even when no one is watching. Chapter 7. Compliance with Guidelines and Standards. You know, it's not just about what we think is important. Organizations like the World Health Organization and the Centers for Disease Control and Prevention have made hand hygiene a top priority in healthcare settings. They've developed specific guidelines and recommendations based on scientific evidence to ensure that healthcare workers are following the best practices for hand hygiene. And for good reason. These guidelines are in place to protect everyone, patients, healthcare workers, and the public. It's about creating a culture of safety and responsibility in healthcare. Outro Hand Hygiene Heroes. So there you have it. 7 powerful reasons why hand hygiene is an absolute must in nursing. It's about protecting our patients, protecting ourselves, and upholding the highest standards of care. By making hand hygiene a priority in our daily practice, we can make a real difference in the lives of our patients. We can reduce the spread of infections, improve patient outcomes, and create a safer healthcare environment for everyone. Remember, every time you wash your hands, you're not just completing a task, you're performing an act of compassion, dedication, and professionalism. Keep up the fantastic work, and let's continue to be hand hygiene heroes together. By prioritizing hand hygiene, nurses play a crucial role in reducing infection rates, improving patient outcomes, and upholding the highest standards of care.